Mr. Chairman, thank you and Senator Burr for conducting this hearing. Mr. Secretary, good morning. I arrived a few minutes late this morning because I've just returned from the World War II Memorial, where a Kansas honor flight was there. Had conversations with Kansas veterans again this morning. It's a moving experience each and every time to have that opportunity to visit with our World War II veterans. And again, the conversation was the VA is failing them. Please make certain, Senator Moran, that that doesn't continue. Thousands of veterans across the country, but hundreds of veterans in Kansas visit with me on an ongoing basis, and they tell me they're struggling and suffering stories because of circumstances they find at the Department of Veterans Affairs. They would tell me that the sacrifice that they encountered, if they were willing to say this less than humble sentence, they would say, "Why can't we have the service that we earned and deserved?" And the reality is they earned and deserved that service, and in my view, the Department of Veterans Affairs is not providing those worthy veterans what we have committed to do. The sad story is that many veterans across the country, and certainly in Kansas that I speak to, have lost hope in the Department of Veterans Affairs and just believe that things are never going to get any better. Your announcement of a face-to-face review across the system, Mr. Secretary, I find lacking in what needs to be done. The reality is that we have had review after review, Inspector General report after Inspector General report, questions by this committee and the House Veterans Affairs Committee that as a result, as far as I can tell, has resulted in no action by the Department of Veterans Affairs. The idea that you can conduct a system-wide, as you indicate in your opening testimony, review of the VA using 220 VA employees and visiting 153 medical facilities. Mr. Secretary, we have 1,700 VA points of access to care, and you indicate in your testimony this will provide a full understanding of the VA's scheduling policy and continued integrity in managing patient access to care. I don't see a review that lasts 2 weeks using 220 employees and looking at 153 medical facilities as capable of providing that information. So I would suggest this seems to me to be more damage control than it does to be solving the problem. I actually think that we don't have the need for more information, although that's always welcome. What we need is action based upon the information that has already been provided to the Department of Veterans Affairs. I've served 18 years on the Veterans Affairs Committee. I've worked with 9 Secretaries of Veterans Affairs, and what is seemingly true to me today is that the quality of service, the timeliness of that service is diminishing, not increasing, and that wasn't true until recently. We have a significant number of veterans that we serve today, but Mr. Secretary, we can anticipate more as our military men and women retire from service in Afghanistan and Iraq. We have an aging World War II veteran population. If we can't care for the veterans that we are trying to care for today, how do we expect the Department of Veterans Affairs to care for those as the numbers and seriousness of their condition increase? So, Mr. Secretary, I look forward to hearing what you have to say today. I welcome that conversation. But in my view, an additional review by your department is not the answer. The answer is action by the Department of Veterans Affairs that changes the system that you are leading and changes the culture and nature of the folks that are your employees. I look forward to your testimony. I look forward to making certain that we keep our commitment to those who served our country. Thank you.